The aim of airway management is to ensure adequate ventilation, so oxygen can move in and carbon dioxide out of the lungs. First aid measures include head tilt and chin lift, a jaw thrust, and oropharyngeal airway. With the exception of major hemorrhages and defibrillation during cardiac arrest, airway management is the most important skill to learn, as ineffective airways leads to oxygen deficiency and death. The first manoeuvre is a simple head tilt and chin lift. The patient's head is tilted backwards while simultaneously lifting the patient's chin with your other hand. The second manoeuvre can be used when the head tilt and chin lift is inadequate, or where you may suspect a neck injury. Your fingers are used to lift the corners of the jawbone upwards while lifting the chin simultaneously. You can also use an oropharyngeal airway, sometimes just called an oral airway. You need to make an approximate measurement first by measuring from the middle of the patient's mouth to the angle of the jaw. This does not need to be an exact measurement. The airway is inserted facing upwards and then rotated through 180 degrees until it sits inside the mouth over the tongue. If the patient is not breathing, you must breathe for them. You may use a bag valve mask device for this with two people using it, one to hold the mask and the other to squeeze the bag. They can be difficult to use single-handed unless you are very experienced. You should clamp the mask to the face using a jaw thrust and your thumbs to hold the mask down. The chin can be pulled up as well to improve the seal onto the mask. The second person squeezes the bag at a normal breathing rate. The bag and mask unit uses room air to fill it, around 21% oxygen. If you connect to oxygen, it can deliver 90% or more. To do this, first turn on the oxygen cylinder and check it is full. Then attach the tube from the bag and the mask device to the oxygen. Then turn the oxygen flow to 10 litres per minute. A full cylinder will last approximately 40 minutes.